Hello, everyone, and welcome to Drona Institute. I'm Dr. Shahnaz Fathima. I'm here to talk to you about some of the key aspects of research in Ayurveda. In Drona, you may be trying your best to achieve the best results in PG or PSC entrance examination. And there will be many reasons why at first you want to do a post graduation or become a government servant. Now, whatever the reason is, when you enroll into a post graduation course, in the first year, the main agenda that you would have to complete is to submit a synopsis or a research proposal to the university. And you are expected to conduct proper research which can be beneficial to humankind as well as science, which here is Ayurveda. But unfortunately, this does not happen as it should be. Most of the students do their research during post graduation in order to complete the course. And if you choose to be a government servant, you're expected to provide the best healthcare possible to the population. And for that, you must be aware of the best treatment possibilities and advancements in the medical sciences for proper diagnosis and management of diseases. But that also does not happen usually. This is because many of us are not aware of the importance of research in Ayurveda or the importance of research in our lives. Now, why research? I can give you some general ideas. No matter what career field you are in or how high up you are, there's always more to learn. The same applies to your personal life. No matter how many experiences you have or how diverse your social circle is, there are things that you don't know about. And research helps to unlock the unknowns. It lets you explore the world from different perspectives and fuels a deeper understanding. Now, the most obvious reason to do research is that you learn more. The process of research opens up new opportunities for learning and growth. Research encourages you to find the most recent information available. And with the latest information, you will be better equipped to talk about a subject and build on ideas. When you have done the research, it's much harder for someone to poke holes in what you are saying. The research process rewards curiosity. And when you are committed to learning, you're always in a place of growth. Curiosity is also good for your health, isn't it? Now, why research in Ayurveda? Interestingly, Ayurveda has the ability to treat many chronic diseases such as diabetes, arthritis, and asthma, in which modern medicine is not much highly effective. Unfortunately, due to lack of scientific validation, this is not highly accepted by other communities. Hence, evidence based research is highly needed for global recognition and acceptance of Ayurveda. Now, according to World Health Organization, about 70 to 80% of the world's population rely on non-conventional medicines, mainly of herbal sources, in their healthcare. Now, this public interest for the treatment with complementary and alternative medicine is mainly due to increased side effects in synthetic drugs or lack of curative treatment for several chronic diseases, high cost of their new drugs, microbial resistance, and emerging diseases, etc. Now, although Ayurveda treatment is highly effective, proper mode of action, pharmacology, pharmacokinetics, and pharmacovigilance of many important Ayurvedic drugs are still not fully explored. Moreover, the comprehensive knowledge of the basic ideologies of Ayurveda is poorly acceptable scientifically due to lack of evidence. Now, why is Ayurveda lagging behind? Young Ayurvedic scholars, although enthusiastic, are not very clear about their views on the future of Ayurveda. Moreover, they are not even very clear that how to expose their valuable research outputs on Ayurveda. Only a few organizations have well established research infrastructure for exclusive research in Ayurveda. Experienced researchers with knowledge of modern technologies are required to conduct advanced and quality research in Ayurveda. Now, more than 1,000 Ayurvedic postgraduates pass out each year and enter into a streamline of academics or practice. Among them, only a few choose their profession as researcher in Ayurveda. Neither has the Ayurvedic teaching changed in the last 50 years, nor have the textbooks enriched with new research methodologies. Now, you tell me, how will Ayurveda grow and flourish in this scenario? Coming to integrative research. Interestingly, there are certain examples of Ayurveda and Western medicine working well when used in combination. For example, rheumatoid arthritis, a chronic and immune mediated disease that causes pain and inflammation, are not well treatable in modern Western medicine. Presently, methotrexate achieves a response in 40 to 60% patients, which cannot say satisfactory at all. Furthermore, methotrexate is associated with distressing and potentially serious side effects. As a result, 68 to 94% of arthritis patients use complementary and alternative medicine therapy, including Ayurveda. Therefore, Ayurveda and Western medicine should be considered as two sides of a coin, and they must come together to work for humankind. But for this, evidence is a must. And the concept of Ayurveda treatment is broad, which heal the human being as a whole, whereas Western system of medicine has traditionally operated from only a cure model. Now, the value of healthcare could be increased tremendously through personalized medicine that could be helpful to predict disease risk, prevent progress of disease, and manage treatments more efficiently. A personalized medicine does not mean just the right drug for the right individual, but the right drug for the specific disease affecting a specific individual. Now, this concept will surely make clinical trials more efficient by reducing the cost usually raises due to side effects and prescription of drugs those are not effective in certain genotypes. Otherwise, Ayurveda will gradually lose its identity and will become a history of medicine. Although the process of research is time taking, but it is the only way to overcome the difficulties in the promotion of Ayurveda worldwide. Even today, postgraduate research is the main research source for Ayurveda in educational institutions. In a study conducted in 40 interns of Ayurveda, 36 preferred clinical practice as first career priority, whereas 4 selected teaching as option. None of them chose research as their first priority. When asked about this rationale behind this priority, they unanimously opined that Ayurveda is a clinical science and they have opted for a medical degree, hence, clinical practice obviously becomes their first preference. They also feel that treating the patient and thereby helping mankind is a noble job, and they would be happier to take up this job. Further, they have experienced that the physician who treats the patient receive high regards in the society, and that is why their preference is towards clinical practice. But have you ever thought, being a clinician, you would be able to treat a specific population or be able to work on an individual level? But being a researcher helps you to study populations and draw generalized conclusions which would be helpful to the whole mankind. Having a proper knowledge and research prior to entering into postgraduate institutions or government sector can make you in a better position to conduct full-fledged research studies during the postgraduate tenure. Now, this will also help to improve the standards of MD or MS dissertations and PhD theses. If you have like other career plans like becoming a teacher in Ayurveda, to become a teacher in Ayurveda at its entry position, a postgraduate qualification in the concerned subject is the minimum required. And for higher faculty positions, additional teaching or research experience and publications are required, which are 10 years and 5 papers in case of professor, 5 years and 3 papers in case of associate professor. And these publications are required to be from recognized journals. Whichever career choice you make, research knowingly or unknowingly becomes an essential part of your journey to find yourself more potent, confident, and well equipped. I hope this video helps you understand the importance and potential of research, especially for Ayurveda graduates. Thank you so much.